Ever wondered what's truly going on inside your child when they've taken a tumble? Or maybe have an unexplained cough or swallowed something they shouldn't have? It's a natural, heart-stopping concern for any parent, right? Wanting to know quickly and safely. Welcome to Have More Babies, the show where we take your sources and, well, we extract the most important nuggets of knowledge to keep you well informed. Think of us as, maybe, medical detectives, solving mysteries with an invisible lens. Today we're embarking on an important exploration into something many parents encounter but might feel a little, uneasy about. Pediatric x-rays. We're going to demystify this essential diagnostic tool for you, helping you understand its necessity and, importantly, its safety. We've got some fantastic material from Omega Pediatrics all about X-ray marvels, unveiling the hidden wonders of your child's inner world.
Yeah, and what's truly fascinating here is how X-rays offer us this non-invasive window. It's almost magical, really, into a child's internal structures. They provide crucial information that, well, literally lets us see inside, guiding medical decisions without needing more intrusive measures. So our mission today is really to address those common parental concerns head-on, emphasize the rigorous safety protocols that are in place, and highlight why this imaging technique is just indispensable in modern pediatric care.
Okay, so before we get into the nitty-gritty, let's establish a common understanding. When we talk about an X-ray in the context of your child, what exactly is it? How does it give us that peek inside?
Right. So at its core, an X-ray is a form of electromagnetic radiation. You can think of it like a very, very high energy light. What makes it so useful is its ability to pass through the soft tissues in the body like skin, muscle, organs, but it gets absorbed by denser materials like bone.
Ah, okay, so denser stuff blocks it more.
Exactly. So when these X-rays hit a special detector plate after passing through your child, the bones, they appear bright white because they've absorbed most of the radiation, whereas air-filled lungs look dark. This allows us to see a clear, contrasting picture of what's happening internally. It's really about getting a precise, detailed snapshot of, a hidden world, which is absolutely fundamental for accurate diagnosis when a child is unwell or injured.
So it's not just some fuzzy image, it's more like a detailed map of the body's internal landscape. Gives us that superhero vision we were talking about. And knowing we have that tool is, well, it's reassuring. Now, for many parents, I think the biggest question is when. When is this powerful diagnostic tool truly needed? Does it sometimes feel like doctors jump to X-rays too quickly? What are those critical moments when an X-ray becomes absolutely indispensable?
That's a very valid concern. And it's where the principle of justified usage really comes in. We never recommend an X-ray unless it's truly necessary. One of the primary and maybe most obvious reasons for a pediatric X-ray is assessing fractures, bone breaks.
Right. Broken bone.
Yeah. Whether it's from an unexpected fall, a playground tumble, maybe a bike accident, or sports-related injury, X-rays provide incredibly detailed images that help diagnose those bone breaks or even hairline cracks. Without this visual confirmation, accurately setting a bone or figuring out the precise extent of an injury, it would be significantly more challenging. Could potentially lead to improper healing or, a prolonged recovery. It's like trying to solve a puzzle with a crucial piece missing.
That clarity for bone injuries sounds truly indispensable. You really can't treat what you can't clearly see. What other internal issues does this tool help uncover, maybe in less obvious situations?
Well, beyond bones, X-rays are critical for detecting certain infections, especially those affecting the chest or sinuses. For example, in cases of suspected pneumonia, an X-ray can reveal not just fluid buildup, but also these characteristic patterns of infiltrates in the lungs.
Infiltrates, okay.
Yeah, and these patterns can sometimes help distinguish between, say, a bacterial or a viral infection, which is crucial because it directly guides the pediatrician towards the most effective treatment. Is it an antibiotic, an antiviral, or just supportive care? This level of detail isn't always obvious just from listening to a cough or checking a fever. So an X-ray becomes a key diagnostic step, making sure we don't overtreat or undertreat.
Okay, so it's not just for broken bones. It's about fine-tuning our understanding of what's going on with soft tissues, like lungs, when an infection is suspected, guiding treatment in a very precise way. That's really important for getting kids better faster.
Absolutely. And a third, incredibly vital reason, particularly with our youngest children, is locating foreign objects.
Ah, yes. The swallowing things phase.
Exactly. It's an unfortunate but, pretty common scenario in childhood. Accidental ingestion or inhalation of small items, things like coins, toy parts, button batteries.
Oh, batteries are scary.
They're very dangerous, and X-rays are often the quickest and most effective way to precisely locate these objects within the body. I I vividly recall a worried parent who rushed in with their toddler, convinced she'd swallowed a tiny, shiny earring. The X-ray, it quickly pinpointed it, allowed us to plan for safe removal without any guesswork. This immediate insight can prevent serious complications and brings immense relief to anxious families. Without it, intervention could be significantly delayed.
Wow. That really drives home that it's not just a general look-see. It's about targeted, vital information for very specific, sometimes really urgent concerns. Okay, let's shift gears a bit. Let's talk about the actual experience. For a child, any medical procedure can be daunting. And for parents, the unknown can be anxiety-inducing. What's the X-ray process like? How simple and quick is it for them?
The process is generally quite straightforward, efficient, and surprisingly quick. First, we focus on patient positioning. The child is carefully positioned based on the specific area we need to image. This ensures the resulting images give a clear view. For instance, to get a good chest X-ray, they might stand in front of the plate.
Okay.
Now, with younger children, achieving that precise positioning, well, it can be a gentle art. Sometimes, specialized immobilization tools might be used not to restrain them aggressively, let me be clear, but more to help them stay still comfortably for just those few crucial seconds. This helps ensure the image doesn't blur, and we get the diagnostic clarity we need the first time. Avoids repeat X-rays.
Right. I can imagine that skilled, gentle positioning makes a huge difference, getting good results the first time and making the child feel safer.
Exactly. Then comes the imaging capture itself. The X-ray machine captures the images swiftly and painlessly. The child is just asked to remain still for a very short duration, typically just a few seconds, while the image is taken. It's not a long, uncomfortable process, which is a huge advantage when working with children who, have limited patience.
That swiftness must be a relief for anxious families. Less time being still or anxious is always a win with children. And once those images are captured, what's next?
So, following the imaging, a radiologist interprets the results. This isn't just any doctor. A radiologist is a physician specialized in interpreting medical images.
Ah, a specialist.
Yes. Trained to look for subtle signs, patterns, or anomalies that a general practitioner might not see every day. Their expert analysis is a crucial step in translating those black, white, and gray images into meaningful diagnostic information. The simplicity and efficiency of the whole process can often alleviate concerns and contribute to a smoother, less stressful experience for both kids and their parents.
It's good to know it's not a long, drawn-out affair and that a specialist is making sense of those images. But let's be honest, the big elephant in the room, the question on every parent's mind, radiation exposure. How safe are X-rays for our little ones, and what specific measures are in place to protect them?
This is, yes, a profoundly common and understandable concern, and it's one we take very, very seriously. It's important to understand that modern X-ray machines are designed to minimize radiation exposure significantly. The levels used in pediatric imaging are carefully controlled. It's about striking a precise balance between diagnostic necessity and safety, and these doses are extremely low.
How low are we talking?
Well, to put it into perspective, a typical chest X-ray for a child exposes them to about the same amount of radiation as, say, a few days of natural background radiation, the kind we all experience just by living on Earth, from the sun, the ground.
Wow, okay, just a few days worth.
Roughly, yes. So the actual scale of exposure relative to everyday life is much smaller than many parents might initially fear.
That's incredibly reassuring. Knowing the technology has advanced to be much safer and that the dose is comparable to what we naturally encounter. What about specific protections during the procedure itself?
Right. During X-ray procedures, protective measures are always paramount. Lead aprons, for instance, are commonly used. They shield other parts of the body from unnecessary exposure. This ensures that the radiation is directed only to the specific area under investigation. This additional layer of protection safeguards sensitive organs. It's a carefully orchestrated process.
So it's not a blanket exposure, it's very localized and protected. This isn't a free-for-all, it's a carefully considered step using the best tech and stringent safeguards available.
Precisely. And perhaps most importantly, there's that principle of justified usage we talked about earlier. X-rays are only recommended when absolutely necessary for accurate diagnosis and treatment planning. The decision to perform an X-ray is carefully deliberated, always considering the potential benefits in guiding medical interventions versus any minimal controlled risk. The medical community prioritizes safety, constantly refining technology and protocols. We ensure the diagnostic benefits profoundly outweigh these minimal, controlled risks. It's a thoughtful, deliberated choice, not a casual one.
That makes so much sense. It really is about making the best, most informed decision for the child's health at that moment. Now, stepping back from the technical side for a second, how can parents best prepare their child for an x-ray? It sounds quick, but for a nervous child, even a few seconds can feel like a long time.
That's a crucial point.
Mm.
Preparation can make a huge difference. For younger children, it really helps to explain what will happen in simple, child-friendly terms. You could say something like, they're going to take a special picture of your arm, and you need to be a statue for just a few seconds, like freeze tag.
Haha, okay, like a statue. I like that.
Yeah. Using a favorite toy to practice being still can also help. Make it a game. Many facilities also have child life specialists. These are experts in helping children cope with medical procedures. They use distraction techniques or sometimes just provide a comforting presence. And generally, parents are allowed to be in the room with their child during the x-ray wearing a lead apron themselves, of course. That provides immense comfort and reassurance for the child.
That's wonderful advice, making it a team effort and empowering parents with those tools. So, okay, the x-ray's done. We have these crucial images. What's next? It's not just about getting the picture right. It's about understanding what it means and how it guides your child's ongoing care.
You're absolutely right. The x-ray is just one vital piece of the puzzle. Post-x-ray, a consultation with your pediatrician is a vital step. During this meeting, the results are discussed in detail, giving you, the parent, a clear understanding of the findings and what they mean for your child's health. This ensures transparency and helps you fully grasp what the images reveal.
That sounds like a crucial conversation, turning those gray and white images into understandable information and next steps for parents.
Exactly. And based on those x-ray findings, a tailored treatment plan is then developed. This might involve specific medications or therapies like casting or physical therapy, or maybe even further diagnostic steps if more information is needed. The x-ray directly informs these next steps, making the treatment much more precise and effective. For example, knowing the exact type and location of a fracture means the cast can be applied perfectly, promoting optimal healing.
So it truly guides the whole course of action for the child's recovery. And what about ongoing care or future checks?
Right. In some cases, additional imaging or tests might be recommended for further evaluation, or specific follow-up appointments will be scheduled to monitor healing or treatment effectiveness. These follow-up measures contribute to ongoing monitoring and adjustment of the treatment plan as needed. This continuity of care is vital. It ensures that the x-ray is just one part of a comprehensive, ongoing approach to a child's health journey. It adapts as your child's condition evolves.
It's deeply reassuring to know it's part of a bigger, thoughtful plan, leading to tailored care and continuous support. Now, while x-rays clearly play a pivotal role, our sources remind us they're not the only tool in the diagnostic toolbox. When might other imaging methods be considered more appropriate? How do medical teams decide?
That's a great point. While x-rays are excellent for certain things, like bones and some chest conditions, they aren't always the best choice, particularly for detailed views of soft tissues or in situations where radiation should be entirely avoided if possible. This is where other advanced imaging techniques like ultrasound and MRI come in. These methods offer powerful alternatives to x-rays in specific situations.
So it's definitely not a one-size-fits-all approach then. How do medical teams ensure they're picking the right tool for each unique child and situation?
Well, the choice between these different methods is carefully tailored to several factors. It depends on the child's age, the specific anatomical area we need to look at, and the precise diagnostic questions the medical team needs to answer. For instance, an ultrasound uses sound waves, no radiation, to create real-time images. It's excellent for examining soft tissues, fluid-filled organs like kidneys or the bladder, or for conditions where we need to completely avoid radiation, like during pregnancy in older teens.
Okay, sound waves, like sonar.
Kind of like that, yeah. And an MRI, on the other hand, uses powerful magnets and radio waves. It provides incredibly detailed images of organs, soft tissue structures, the brain, the spinal cord, things an X-ray simply can't capture with the same clarity. What's fascinating here is how medical teams ensure a truly comprehensive approach. They leverage these diverse technologies to get the clearest, most appropriate diagnostic insights for each unique situation.
It's about having a full range of precise options to get the clearest picture, specific to the situation. That's incredibly powerful. So what does all this mean for you, the parent, as you navigate your child's healthcare journey?
Fundamentally, this all boils down to empowerment. Knowing the why and how behind pediatric x-rays means you can approach these situations with more confidence, more clarity, hopefully reducing that natural anxiety. It also raises an important question. How can parents continue to stay informed and proactive in their child's health journey? leveraging expert advice and resources beyond just, this one conversation.
And that brings us beautifully to our essential next step. For more details, to stay updated on children's health topics, and really to ensure you're nurturing a culture of health awareness in your family, we highly recommend you visit omegapediatrics.com.
Yes, they are a fantastic resource. They offer a really comprehensive array of pediatric services, everything from acute and preventive care to lactation support, complete immunization information, and even specialized care for conditions like asthma and ADHD. Their website offers a wealth of information to guide you.
It really is your ultimate go-to resource for a comprehensive approach to your child's complete well-being. Don't wait, check it out, omegapediatrics.com today.
So we've truly taken a deep look into pediatric x-rays today, haven't we? Demystifying this crucial diagnostic tool. We've covered everything from what they are and when they're absolutely needed, to the quick and reassuring procedure, the crucial safety measures, how you can prepare your child, what happens afterwards, and even the alternative imaging options available. Yeah, and the journey of staying informed about pediatric health, it's really a lifelong commitment. What stands out to me, and what I hope stands out to you listening, is the incredible balance healthcare professionals strike every single day, leveraging these powerful diagnostic tools while meticulously safeguarding our children's well-being. It really encourages us all to continually seek clarity, to engage openly with our pediatricians, ensuring we're making the most informed and confident decisions for our children's health.
We truly hope this exploration has given you valuable insights and maybe a bit more confidence in navigating your child's healthcare. Remember, for more comprehensive information and to explore a full range of pediatric services, please head over to omegapediatrics.com. And hey, if you found this discussion helpful, please take just a moment to like this video. Subscribe to our channel for more valuable insights like this. And maybe share it with other parents who might benefit. Your support really helps us continue to bring you these important conversations. Thank you so much for joining us on Have More Babies. We'll catch you next time.